My name is Jason Rogers, and I'm a total joint replacement surgeon at Center for Sports Medicine. Growing up, I played sports and gradually began having knee pain. It was the inability to exercise and be able to do things with my kids that really made me want to take a step forward. Ultimately, it led to a number of procedures and injections, and then subsequently needing a partial knee replacement. I've done these procedures thousands of times at this point, but certainly becoming a patient is a daunting and nerve-wracking process. Since my surgery, I have been able to squat a lot easier. I'm still in the recovery process, so those activities will continue to improve, but from that perspective, I have definitely seen progress, and my quality of life has changed. I've been able to walk a lot further, been able to take my family to Disney World and walk for 12 hours each day, and was able to do that. That was not possible prior to surgery. Also, I was able to take my son to a father-son camp, and we were up on our feet doing lots of various activities throughout the day, 3 days in a row, including getting into a canoe, which would have been challenging prior to surgery, but now I'm able to do that. It certainly gives me a new appreciation for what it's like to go in as a patient and trust your surgeon, knowing that they're going to be the ones that's going to take care of you. The pain, the stiffness, the discomfort, especially in the evenings, is a real thing. I understand it more, and thus I have changed my post-operative medication regimen to help with what worked for me. I'm trying to now take that and step forward and help my patients with the same knowledge that I obtained through surgery. This experience didn't just change my knee, it changed my practice. And that's something I hope each one of my patients can benefit from.